Welcome to Ask the Therapist, the podcast that invites you into the therapist room to explore the world of mental health with me, your host, Sarah Rees. Hello and welcome to this episode of Ask the Therapist. Today I'm talking with Dr Julia Wahl, a clinical psychologist, author, researcher, podcast host. She's trained in compassion-focused therapy with Professor Paul Gilbert, and a friend, I'd like to say. And she's based in Warsaw in Poland, and had the pleasure of meeting Julia after following her work for a number of years at the Compassionate Mind conference in Birmingham last October. And over this last year, she has been writing the Cancer Workbook. It's a book to help people develop a compassionate mind for treatment, recovery and survival. It's for people experiencing cancer, for healthcare professionals and for relatives as well. It's out now for pre-order. It's going to be a really fundamental text that's really going to be so helpful for us in the clinical world and for people that are going through cancer diagnosis and for people living well with cancer. I really enjoyed our in-depth conversation and I'm sure you will too. Welcome so much to Ask the Therapist, Julia. It's lovely to have you here. We've just got to know each other over this last year and it's been an absolute delight. And I want to ask, could you tell everybody a little bit about you to start with, I suppose?
So I guess this is my least favorite part, Sarah. I was hoping for you to introduce me rather than me having to introduce myself, but in the spirit of being brave.
Go for it. Yeah, a little bit of exposure.
So I am a psychologist. I'm also a lecturer. I dread saying that I'm a writer. Well, dread because I still haven't fully embraced this writing or writer's identity.
How do you
But
not?
I
You definitely are. You were writing 4 books, were you not, when I asked?
Yes, so we'll discuss my psychopathology maybe a little bit later. But I specialize in contemplative approaches, science, and also recently eco-psychology and ecotherapy. So these days, I'd say that the majority of my time is spent teaching, lecturing, educating people on these topics.
Amazing. And whereabouts in Poland are you? Is that where you are at the moment?
Yes. Well, currently I am in Szczecin, which is very close to the German border. But I live in Poznan, which is quite a recent development because for the majority of my adult life, it's been Warsaw. It's still my identity is still split, between these two cities now. So Warsaw and Poznan. And I also did spend some time in Derby, of all places. So a lovely place for pensioners. No, I'm joking, of course, but it may be not the most vibrant of cities. But the good thing about the Derby, other than its green areas, is the people. And I met some wonderful people in Derby, some wonderful friends, and
it's home to our Professor Paul Gilbert,
exactly.
isn't it?
And yeah, so he's to be blamed or thanked for Derby in my life, because that's why I ended up in Derby, to be honest.
Did you do a PhD there? Is
I
that...
did do my PhD at Derby, University of Derby, and that's also because of Paul, because I don't want to say that I was his stalker, but it is true that I encouraged by my then supervisor, Chris Germer, because I I did say to Chris that I wasn't fully satisfied with with his conceptualization of compassion, and there was something missing. And he was very lovely and very patient about it, patient with me. And he said, "I understand what you're saying. And actually, there's this guy in the UK, and I'm sure you would really like him. And I think he's the answer to." What you're saying here, you know, what you're looking for. And so that person was this Paul. And so I Googled him, and there was a conference coming up in London on empathy and compassion. So that's how I met Paul. And then there was another conference in Manchester, and he was also very patient with me. This annoying person. God knows who she is, where she's from, but he was very helpful and helped me with finding my supervisors, including my director of study, David, saying hello to David. And actually, we're writing a book together. Well, there's a bit of a delay, but yes, there will be a book on cancer care, but maybe I'll tell you about it a little bit later. So that's how
How
Darby.
did you end up being supervised by Chris Germer?
Sorry, can you say that again?
How did you end up being
Oh,
supervised by Chris?
so again, it was a sort of a coincidence. I was missing something in mindfulness, and together with a friend of mine, Magda, we're looking for something that would be more, how can I put it? Well, that would be the answer to what we thought would be important to our patients. And whilst, as we know, mindfulness is very important, and it helps you um, 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 basically notice what is happening, learn to be with that difficulty. But actually, that being with that difficulty, which is called exposure, might be difficult at times, because yes, you are in fact exposing yourself. And that's why we need compassion. So I always say that there are these three regulatory tools, tools that regulate our affective state. So there is attention, there is mindfulness, and there is compassion. So with attention, as we know, if there's a difficult emotion or a difficult thought, and it's like in that situation, in that moment, it's like there's nothing else. You know, we believe that that's the only truth about our reality, or even about ourselves, our identity.
That's showing the first kind of psychology of compassion, isn't it? The ability to turn towards, and mindfulness
Mm.
helps turn towards. But then if there's no second psychology.
Exactly. So with you know, just with the shifting of attention, so I can shift my attention to something different rather than this difficult emotion or difficult thought. And so then we have, as you were saying, mindfulness. So being with that difficulty, well, even opening up to that pain, or in some cases suffering. But then being with it isn't enough. And also, in some cases, it might just be too challenging for some of us, or in certain situations. So, how to therefore initiate the processes of appropriate effect, you know, so appropriate emotional states that would actually help us be more resilient when it comes to that difficulty. So we need these three tools. And so we, me, and going back to that story, and apologies, I like to digress. I never know whether it's to do with intelligence or Alzheimer's. I do hope it's the former, rather than the latter. But so something was missing for us, and we found this guy Chris Germer doing things on self-compassion. And so me being, I don't want to say an arrogant 20, I guess, 6 year old. I guess I was at this point. I just emailed him, and he was crazy enough to respond to my email and accept my invitation. So he came over and did a workshop for us in Warsaw, in Poland, and then the next step was for me to ask him to supervise me, because I was looking for a person specializing in mindfulness and compassion. But again, self-compassion there was something missing in that concept for me. Well, the other, as we know, that was about the other flows of compassion, because we do not live in a void, and whilst at times we need to go back to that first flow of compassion, we need to focus more on ourselves. If we end up solely focusing ourselves, it's just as problematic as not having self-compassion at all. So we basically end up in that same, pardon my French, fucked up situation, so we need to embrace the free flows of compassion. Plus, what I was missing in that concept, whilst I really appreciate it, and I love the work that Chris is doing, was the scientific background or rationale behind it, because that is something that's very important to me. And
You mean
no.
evolutionary psychology behind it? Do you mean that Paul talks about that?
Yes, yeah, because knowledge is about being safe, and actually knowing what you're doing, and we want to be brave enough to be critical of what we do. So that was an important part for me.
That's the
Mhm.
scientific mind, isn't it? Always questioning. It sounds like you're
Yes, yes,
that's
yeah,
very much who you
yes,
are. And I
yeah.
always think that being a therapist and psychologist is such an interesting and strange career. What do you think
Mm.
led you to kind of going down that path and choosing mindfulness? And
Uh, as you know, Sarah, we're always interested in the things that we may be that we may be lacking in. So maybe to start with, why mindfulness? Because quite often I'm not very mindful, and what I mean by that is that I can be quite hectic, chaotic. My mind is all over the place. You can call it being creative, and that's the other side of that. But mindfulness was a tool, an approach, and a way of being that was helping me to be more grounded.
it's not the easy thing, is it? The more creative you are, the busier your mind, which I have a bit of that as well. It's kind of,
Yes.
and with my
Yeah.
clients that I work with that have these incredible minds that can go to
Mm.
all these different places. When I talk to them about mindfulness, often they go, not for me, that. But I kind of say, the busier our minds, the more we benefit. But it's kind of, it's a, although it's helpful for you, it's
Yeah.
generally not the thing that you find the easiest when you like.
So I think and my excuse, let's call it, for doing mindfulness, because I may not strike you as not always. There are moments, of course, as a monk-like figure. I just don't have that style. That's not my personality. What I'm saying is that maybe it's important to have different representatives, different people doing different things, including doing mindfulness, because then if the person comes to us who's like, well, I can't imagine myself just sitting down and focusing on my effing breath and just doing nothing. There are so many things that I should be doing right now, including doing things for others, because I know some beautiful human beings, let's call them activists, and some of them are, who are like, I need to be helping people right now and not just focusing on myself.
Mm.
And I really appreciate that. But as we know, again, not focusing on yourself can be just as problematic as focusing on yourself. So never be extreme on any of these spectrums. So we need to have, if we want to be taking appropriate actions, we need to have also appropriate time to reflect on things. Not to rush into things, because as we know in CFT, in compassion focused therapy, sometimes I have the courage to do things. So I may see a person who struggles, like Paul would say, oh, there's a person who's drowning, but I don't have the wisdom, and whilst I'm trying to save the person, I realize that I'm actually, well, I can't swim, so where is that wisdom,
Yeah, you have
knowing what the right tools are.
a compassionate motivation, but without the wisdom, then
Exactly. So I think, we are always focused on the things that that maybe are missing or are a bit of a challenge to us. So that's why mindfulness and compassion. I want to say that, well, it's not as problematic for me because I'm a very compassionate person, and well, I think I am a caring person, but I can't say that compassion is always easy for me, because compassion, as we know, is not about liking or loving the people who we already like or love. That is easy. That's quite easy, even if at times they drive us crazy. The thing is to not be to be compassionate, and that includes the courage, the wisdom, knowing what to do, how to do it, towards the people who are problematic to us, or we are problematic to us, because it goes both ways, obviously, and how to inspire the right effective system. Because if there's a person who's saying openly or not, doesn't matter, because we can quite often sense these things quite easily. Our threat system is being triggered in that situation, So and we are at times over focusing on ourselves because there's this potential threat, So how to notice that, and maybe if I can't fully stop this a threat reaction, experience in myself, I can focus more on these other systems, and be less threatened and actually be able to communicate with that person rather than trying to retaliate and trying to do something
live
to
life
that person.
through the threat system to go into
Yes,
kind of some of
exactly,
the other
exactly.
systems. You strike me as sitting very much in your drive system. I know when we met, you were writing 4 books, even though you say you don't identify as a writer. I think you are. Where does your drive come from? Where does that motivation come from?
Well, I would say that's not my fault, Sarah.
It's not your fault. It is your responsibility.
But it is my responsibility. That's absolutely true. So I think it's I'm saying it's not my fault because I think it has to do with my temperament. So it's to do with my neurophysiology, my genes, and of course the culture that, and by that I mean my family, that my parents who have inspired me to focus on certain topics and activities. So that's part of both my physiology and my family culture. Let's say. But I to answer your question, I would say that my drive system is also mixed with my threat system.
Right.
It's either because, as we know, it's not that straightforward, so sometimes these two things are both in the mix, intertwined, and sometimes we're even, well, if it's something that seems like and well, a good thing for us to be doing, and an exciting thing as well. it's because of our threat system. So, and it might be to do with our own personal threat system, or thinking about all these other threats that are in the world. So, what drives me is, first of all, my own personal drive, and just this need to be creative. To explore different topics, and to see how I can make them work, how and I can put them in practice. Because again, whilst I appreciate my theory and my knowledge, if it's purely theoretical, then it's, well, what's the point to that? It needs to be of use. It needs to be of help. So what is helpful in all these beautiful intellectual endeavors, but the other thing is to do with my threat system, because I would like for both me personally and for the world in general to be less threatened, more at ease.
Yeah.
Yeah.
Yeah. And you've just, I think, if you just finished the book on,
Not yet, but almost.
okay, tell us about it. So it's the Cancer Workbook, but
That
it's
is
training
correct.
in
Yes.
compassion focused therapy. How did that come about? I'm really, one of my dear friends has just gone through. We've had a year of, she's gone
Mm,
through having breast
mm,
cancer.
mm,
Somebody so fit and healthy. She just turned
mm,
50 and then got this massive diagnosis. So it's been a hell of a journey.
mm,
So, I think this is just such an important area and topic. I'd
mm,
like to know what kind
mm.
of how you've ended up writing this book on cancer.
Well, and there's first of all, I should say that again, was something personal, because what seems like ages ago, my mother, she had cancer.
Mm.
And so it was a personal, or it has been, because it's never over. Cancer, it's like hanging over you. Once it's there, it's always there in the picture somehow, well, in the background. And because of that, I thought, well, actually, I don't hear that much about it. It's like we're afraid to mention the C word. It's like with the S word. I don't necessarily have to be specializing in somatic psychology, but there will be patients who may end up being ill, including having cancer, or people who have family members who suffer from cancer. Um, and I did see also in myself, and I still do. I have to be honest about it. That's maybe why I have this a slight delay in writing this book. This avoidance, some topics we don't want to necessarily be focusing on. It's like this other version of wishful thinking. It's like, once I mention it, oh my goodness, this might actually happen to me, so better not mention it at
Ah,
all.
yeah,
Yeah.
we want it to be somewhere else.
Yes.
We know it's
Yes.
around, but it's over
Yes.
there. It's not in our world. Yeah.
Exactly. So the Korean German philosopher Han calls it the algophobia phenomenon. So the fear of pain. So we would just want to avoid any type of pain at any cost. So we want to just sedate ourselves, including sedating ourselves with at times meditation or mindfulness. We mentioned it. So, but it's just a tool, and it depends on us how we use it or misuse it, or um, so so it was also a personal act. I want to say that it was all for the patients, but that wouldn't be true. So it was an act of a personal challenge to me, and a personal journey, and I have to say that yes, I am still on the journey to be brave enough to be faced with the things that I don't want to be faced with.
Yeah, yeah,
uh,
it's so important because actually it's like we'll all kind of meet cancer in one form or another.
yes, or another.
Like, there's no two ways about it. Are there common struggles that you've seen people with cancer face, or people around them?
Yes, I would like to, and I was thinking about how to answer that question before. And I was thinking maybe I'll give you a beautiful list from psycho-oncology manual, but I would put it simply: change. That so many things are changing in so many different areas. So it's the physical dimension, including quite often going through a lot of physical pain, so physical pain, okay. And the body might be quite different after once you undergo all these different types of procedures, surgeries, treatment, etc. Changes in your social structure, because well, some people, and again, coming from the compassionate perspective, we understand why that is, but some people might be reluctant to be in touch with them, with us, sorry, with well, so in touch with that cancer experience, and as Paul would say, in order to learn about, and I am paraphrasing him right now, learn about compassion more, we should also learn more about how we dissociate from pain and painful experiences. So it's not to blame these people, but to understand why that is. But having said that, that is very difficult for the person who's going through that experience, because suddenly there aren't that many people around, and it's also
Yeah, it's when you walk into a room and you have that conversation, it's kind of,
yeah.
it's not the conversation people want to be having, is it? So people
Mm,
want to shut it down and dissociate from
mm,
it. It's so
mm,
scary to everybody
mm.
around you.
and and uh, you're supposed to now embrace that cancer identity, and somehow people don't want to embrace that cancer identity. And I would say that I do understand it, and actually it's about, whilst uh, uh, trying to accept the situation that you are now in. It's not to say that now you are only cancer. It's like, I am cancer. Like with any identity, if we if we are depressed, and then we say, quite often it's like there's nothing else to who we are. Well, that's not true. Okay, this may be the main thing in your life right now, but that's not the only thing. And actually, is it really? Maybe there are other areas that are just as important. And actually, with the people that I work with, for some of them, and it's not that they are not brave enough to discuss their cancer experience, but they want to be telling me about other things that are happening in their life.
Yeah.
So we have the freedom to discuss cancer and all that it entails, all treatment, all the issues that come with that. But they want to tell me about these other identities they have. I'm still a mother. I'm still a father. I'm still a lover. Uh, uh, I'm even still a taxpayer, so I'm part of the society, so another change. It's some, illness. It's like being a different type of a citizen. I think it was Susan Sontag who said that it's a different type of citizenship. That we would prefer to be in the kingdom of the healthy, rather than being in the kingdom of the ill. But actually, at some stage, we're having to embrace both of these identities or citizenships.
And that is, it's so consuming, isn't it? Especially going through the treatment and getting, how do you, if that becomes your identity, how do you
Mm-hmm.
shift back? If illness
Mm-hmm.
becomes your identity for a
Mm-hmm.
while,
Mm-hmm.
it's all consuming, isn't
It's
it?
all
It, you know,
consuming, yeah. Yeah.
the treatment and stuff. How do you shift back?
Mm-hmm.
Or is
Mm-hmm.
there a new normal? Do you kind of go to a new normal where you kind of have a foot in both kingdoms? You are very in touch with illness and what that means, and
Mm-hmm.
what does that look like?
Well, I don't want to be generalizing here because working with patients taught me one thing, that whenever I have these smart answers, my clinical formulations, terms. This may not work with that particular person. They might not appreciate that. So I would say, as a true psychologist as well, it all depends. It all depends on the person, because with cancer, first of all, Sarah, as you well know, it depends of the type of cancer, the stage of the cancer, the wider context that the person is in, whether the person has got a good social network or not, what type of personality that person is, so whether the person is more prone to be in their drive or threat system, so there are so many different issues to that question. Going back to your question, I think we shouldn't embrace any of our identities too much. We shouldn't go too far with any of the identities that we have.
Yeah.
That's always problematic. So I would say, and that's quite all right if in the beginning, I am completely in that experience. That's part. It might be part of that experience, but what I think might be helpful, and or what my patients are telling me, because that is, I guess, more important from what I'm thinking about the whole thing, is being able to look at what is happening from that compassionate perspective, from that compassionate identity, if you will. So what would the compassionate self say about what is happening to me? What would be helpful in that situation? So this metacognition with the ingredient of compassion would be what I consider to be most helpful.
What differences have you seen in your in the people that you work with when they've started to integrate compassion?
They become more at ease, and as we know, working as a psychologist or a psychotherapist, or simply as a person who's trying to psychologically support people who are in that experience, is not about trying to save them literally, and sometimes you can't. And I had patients who have died, and that's always very painful. And you're like, I would like for their medical treatment to go so well, and I would like, I would just like for them to be saved. I would like for them to be alive and thriving. But I also see the patients who themselves know that, well, most likely they are going to die. That their minds are more at peace.
Yeah.
That they don't struggle as much. And yeah, that's in some cases that's the most we can do. That's the most important thing. So if we can facilitate that process, help them get to that place, that is absolutely wonderful.
Peace and contentment, having a more settled mind with wherever.
More settled, even if contentment, just, yeah, if that's what being at ease is, then yes. So just not struggling as much, not being in that threat system anymore, just being able to die in a peaceful way.
Yeah.
Mm,
Yeah.
mm,
Because it's so triggering for our threat system when we're
yeah.
unwell, isn't it? How
Mm,
can we compassionately hold illness,
mm,
do you think? How do
mm.
people do that?
That's actually why I'm focusing on compassion, because compassion is about again, it's not about, as you well know, eliminating the difficult, because that is not possible and that wouldn't necessarily be helpful. It's about being more resilient. I'm quite irritated, I have to be honest, whenever I hear that compassion is only about soothing. It's
Yeah.
about these nice cuddly emotions, and I have nothing against being soothed, and it's important, as we know. It's about, in our CFT language, it means being able to self-regulate, to have the better regulation of the three affective modes. Uh, um, but it's not about soothing. We need to self-soothe, so therefore we can learn to be more resilient. You
Mm,
know, so we can be more courageous, including being with that effing cancer, because there's nothing lovely about that experience.
yeah. Yeah.
Um,
So using your strength, and I think it was Gonzalez, I don't know if you know him, he's over in Chile, talks about we need to bring out the passion in compassion.
Yeah, exactly. So these days, quite often there's this reference to fierce compassion. Well, I don't necessarily like the term fierce, because first of all, I think the courage is already in compassion, the way we understand it in CFT, and but yes, that there is passion to compassion, and compassion helps us not only be with the difficult emotions, but also it's initiating, activating the positive emotions, including feeling safer. Doesn't mean that now the world is devoid of dangers,
Mm,
but at least I can feel a little bit safer. I have more access to this safe or soothing affiliative mode of mine. Um, so being more vulnerable, having more openness to my struggles, but also being more resilient.
yeah, yeah, from that place. And who is the cancer workbook for? Would it be good for clinicians, and is it for relatives and people supporting people with cancer? And
Well, I think my editor would accept my answer as being it's for all of us, and it's actually true. It's actually true. So I think this book may be equally helpful to clinicians, so people working with cancer, trying to help cancer people who struggle with cancer. And again, notice I don't want to say cancer patients. I want to say
yeah,
people with cancer,
yeah.
because that's only part of our identity. But it's also
Beautiful switch in our language, isn't it? I
yeah,
think, you know,
yes, and I like the word patient, because it's a person who's patient, and that's true. You need some patience in our struggles. And so it's both for clinicians and for people who struggle with cancer and what follows, cancer treatment, but also for the families to see what may be helpful to their family members, and also to themselves, because quite often, and which is understandable, we don't focus on we don't focus on the people who are not necessarily our cancer patients, but who are their supporting network. So
yeah,
their family and friends, and they also need to have resilience to better support the people who the close ones who are suffering, and themselves, because as we know, that is free flows to compassion. So in order to be with something painful, we need to also learn how to be more resilient. Because even if we're trying to create this perfect word and perfect kind language, there are always going to be situations of pain, whether it's physical as it is in cancer, but also emotional, personal pains and struggles and simple misunderstandings, and I think pain is just unavoidable. You can't avoid it.
No, it's part of being the human condition, isn't it? And our journey through life. It is a part of our life, and we
And
need.
also notice. Yeah, sorry, you were saying.
No,
Yes.
we need tools to be able to work with our
Yeah.
struggles, don't we? So I'm very
Yeah.
excited about when will the book be out? Can we pre-order it yet? I know that's very good for sales, isn't it? That's what I'm hearing.
Yeah, so hopefully by the time this episode comes out, the book will be at least half edited by my editor. So yeah, it'll come. It'll appear in I want to say bookshops, but these days on specific websites rather.
Yeah.
To say yes, in September, if I'm correct here. So
Right, September next year. So hopefully,
September next year. Yes, yes.
right.
If there are no more delays on my side. So.
Right. And how have you found the writing journey?
Mm. Well, once again, there might be a bit of a disappointment, Sarah. It's not that I have a well-established routine. It's a little bit more chaotic than that.
Still a routine. I think mine was very chaotic as well.
So at times I really struggle with that, especially if for a week or two I haven't been writing. Then it's harder to get back into that mode of writing, creative mode, and sometimes it's like physically having to make myself sit in front of the computer and sometimes stare for an hour at the blank, sheet of paper, which is a Word document. But yes, so
Writing now. Have you done all your writing? Is it all in?
I am writing. I am, but having said that, I am trying to be more diligent, more organized. Also because I don't want to be fueling my fret system.
Yeah, yeah.
And because of the responsibility that I feel, as you mentioned, there are some other books to come. One is these books are unfortunately will only be available for now, at least in Polish. So one is about the power of a tribe.
Wow, I'd love to
Yeah.
read that. And community and connection and
Exactly. One is important and what we've lost. More of a popular book that would encourage people to look at how they related to each other and how to create communities.
well, we need that over here, definitely. So it'd be great if
Yes.
that can be translated into a few different languages.
Well, hopefully so. And yeah, so I'm writing that with a good colleague of mine. And another book that I'm writing actually with my partner is on shame. So again, a more popular book, not necessarily addressed to psychotherapists, but focusing on the culture of shame. Um, and what shames us, what are some of the both physiological, genetic, but also culture ingredients of shame, and how we can work with that. So it instead of it being something that makes us passive, because as we know, quite often when we experience shame, whether we shame ourselves or being shamed by others, it's we feel this, we're in this utter state of shock, inertia, it's we're immobilized, we can't move, so even if the intentions, whether it's our inner critic, self-criticism, they're trying to be helpful, other people trying to be helpful, and therefore shaming
What
us.
people recognize when they're shamed?
Mm.
Do you think they would say, I feel shame?
But for some people to say that I am shamed is shameful in itself. Mm.
Yeah.
Because maybe that's not something that's part of their.
When I can feel it with my clients sometimes, but when I feel like there's a resistance to I feel like I have to spend quite a long time helping
Yeah.
people understand that
Yeah.
it's shame.
Yes. Yeah. And even if we were to ask ourselves this question, what is the most shameful experience, in your life? And now imagine telling about the experience to us.
We'll share it on this podcast now.
Yeah, we're sharing on this podcast. So Sarah, I'll ask you about your shame and you'll ask me about my shame. Well, no, it's just, it makes us very uneasy, and maybe shaming us once again. So again, not necessarily a self-help book, but a book that might inspire us coping with shame a little bit better, and rather than immobilizing us. It's about seeing what the function of shame is, and how can it be at some time, in some cases, helpful.
Yeah.
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 But I think in order to work with shame, first we have to shame ourselves or unshame ourselves. That's, and it's not to say that we're not taking any responsibility, but seeing again. To quote Paul, it's not our fault that we have these type of responses, whether these are emotional responses or the thoughts that come up in our minds, or in some cases even certain type of behaviors, because there's an override, like our threat system is just buzzing, or the drive system, by the way. Might be just as problematic. Yeah. So this is not our fault. There are millions millions of years of evolution. And there are our families and the wider culture, because it's not only to do with our poor parents. We can't be always blaming our parents, but so we're in this constant a struggle in a way, because of our physiology and our culture. So it's not our fault, but yes, that's our responsibility. So what can I do about it? Being adults, no, we don't want any inner children. I'm sorry, I don't necessarily appreciate that metaphor. I understand why we use it, because it's safer to refer to children, and children are allowed to have fun and to be free. So therefore, this metaphor feels like a safe one. But I would rather suggest trying to look at ourselves as adults, and can I be, from my adult perspective, just as playful, whilst having the wisdom and the experience. Because with all due respect, even the wisest of children are still children.
Yeah, that's a very good point. Oh, I hope that is published in English as well. I'd love to read that. And shame, I think, is an area that I'm fascinated about, and really keen to learn a lot more about. I'd love to know a little bit more about kind of the mental health services in Poland. Whenever I get somebody on from a different country, because we are struggling here in the UK, and I spoke to somebody in America the other day who is having similar difficulties. What are mental health services like in Poland?
And now there's silence. Yeah. So my silence translates into we're not doing that great. So especially when it comes to children and young adults, it's just gone terribly wrong. I'm hoping with the new government, and they're actually saying that they want to focus. One of the ministers who's responsible for that topic wants to focus more on mental health. But so we'll see how that goes. But we just simply don't have enough psychiatrists, psychotherapists. There isn't enough access, and yes, there are a lot of people in private practice, but it's so expensive, Sarah. It's so expensive.
It's not
and
that.
and many people, if you struggle with something, and you're supposed to wait for another year or two, that's very long. That's too long. Yeah, that's not that great. So I would say the private sector is thriving because we are getting more and more clients, patients. But unfortunately, the Polish equivalent of NHS is maybe is doing a little bit better, I think, than the English NHS. But yeah, there's a long way ahead of us, I think.
Yeah.
But I think it's this could be applied, this answer, to most places in the world.
Yeah, I'm yet to meet somebody who's got some positive wisdom to share or kind of ideas. It feels really scary at the moment, doesn't it?
But
Like have a step back in terms of care vision.
Again, having said that, what always strikes me as a bit strange is that these days we have so much knowledge and expertise and actual tools that may be applied to make this world better, and we're not doing enough. And I think.
Go on, sorry, no.
No, sorry. And I think at times it's to do with our own individual, or should I say individualistic minds, that are harmful to or not as helpful to both ourselves, our individual selves, and others. And so I guess the next year conference, CFT conference in London, that is focusing on the harmful mind, which is the dark side, and not to say, it is your fault, effing person, what the hell are you doing? But understanding again how we operate. So it is our responsibility, but it's hard to be a human being,
Yeah.
And even. And and having that moral imagination, John Paul Lederach calls it moral imagination, imagining the most awful enemies that we might have as parts of our tribes, because we do have this new part of our brains, and it's very difficult because it is, and we would rather avoid certain type of people. And well, I'm sure again, and some people would rather avoid us, but just trying to work with that, trying to communicate better. I don't need to love you or like you, but I need to be collaborating with you, Sarah. But I actually do like you, so which makes it easier for me.
Us, we're okay. Yeah. I run a group for therapists. It's called Therapist Corner. It's on a platform called Substack for writers, and there's about 2,000 of us, all in private practice. But I know I'm really trying to encourage therapists to start kind of trying to deliver their skills and practices in other ways, like on courses, on using Substack, or doing more writing and blog posts, and getting because we have so much knowledge. It's about it's got to come out of the therapy room and just be, a lot of what I'm taught from my CBT perspective. I just think I should have been taught that in school. Why
Yeah,
wasn't I ever told that my mind is crazy and thoughts are not
yeah,
fact? How to manage
yeah,
worry or anxiety? I just think it should be lessons.
yeah. And I, sometimes, I'm struck by well, how to be diplomatic about it. I see these mindfulness or psychology forums or psychotherapy forums, and in some cases these are the most awful forums I ever come across. There's so much hate and competition and times pure aggression, and I'm thinking, how did it go so wrong, or we I should say,
Yeah, and
taking
you always
responsibility.
thinking, because I've had a couple of communities of therapists, and we are a tricky bunch. I mean,
Yeah,
you'd think we do a lot of exploration of the human mind, that we might have got some of it together.
yeah,
Unfortunately, no. Put us in a tribe and a community,
yes.
we behave exactly the same. Hopefully, I would think I'm managing a community a little bit better on a different.
Yeah, but so what I was trying to say, maybe not in a very articulate way, apologies for that, is that if we as people who are supposed to have all the tools and of course knowledge and even wisdom to know how to cope with difficulties with for ourselves and others, at times struggle with it so much, So what about all these other people who may not have the same level of education or psychoeducation, and and what you're doing is just beautiful, Sarah. So congratulations, and because that's a way to inspire not only us in that small tribe of our helping professions, but trying to go beyond that and reach people who might otherwise not learn about certain things. But
Yeah,
because it's in the end, it's about all of us, uh, and
we're all working together. It's that common humanity. At the end of
yes,
the day,
yes,
whatever our skills and knowledge are,
yes.
we're all in this together, and we've got to come together
Yeah,
collaboratively.
yeah, but and also, yeah, what I really appreciate about CFT is that we are trying not to shame ourselves, because sometimes our good intentions or our superficial kindness might actually be a superior perspective that we're taking, so we are trying to be helpful. We're saying something to others, but the way that we're saying certain things actually, is being, shaming the other people.
Yeah.
So how to so the question that we ask in compassion: what is helpful and what isn't? It's not the question of what's bad and good, because that's a bit judgmental. But what's actually helpful, and how can we tell that it is, And of course, it always changes, Uh,
That's interesting. And
yeah.
one question that I ask all my guests that come on this podcast, and I don't know if you saw this, some people don't prepare and some people really getting a tiz about it. But if you could go back to the
Oh,
young
yeah.
version of you, Julia, the 15-year-old version of you, what would you say to yourself? What would you say to young Julia?
Um, well, I would say that I understand you. So again, I understand what you're going through. So what we've been just saying, understand why we have certain types of feelings and reactions. Yeah, I would also say to that version of myself that you don't necessarily have to be liked by every single person on this planet, and that's okay. And appreciate more the people who are actually there to support you.
Yeah, that's lovely.
uh, yes, and be more diligent and do learn to play the piano and
You're going
yes.
into your drive system now, aren't you, insane?
No, but I do regret not. Well, I learned to play the piano, but not to the extent that I would like to. And I know some foreign languages, but yeah, but you are right. That's something that's not as important. That would just be something that I would now enjoy in my soothing affiliative mode.
Bought a piano in COVID and I've literally sat down with it for about 10 minutes. But that's my dream as well. That's my future.
Yeah, and I would also say to the person, be brave, not arrogant, but brave, and um and um and do things, and you can work through your shame, and because I think sometimes shame stops us from being more compassionate to others, because we're so into ourselves, and we are immobilized because of that shame, because we feel that we're not good enough, that only people knew certain things about us, they would never have, liked us or appreciate us, etc. So
You're on
uh,
a mission to shine a light on shame going forward in 2024 and help us
yeah,
all with our shame stories.
yeah. So uh, um, yeah. So I would also say a thing that I know as psychologists, psychotherapists, we shouldn't be saying, but it's all going to be fine. it's re- it's really going to be fine.
Yeah,
Uh,
that's it.
yeah, and don't worry so much. So all the things that we shouldn't be saying, but I would like to hear that as a 15-year-old, and
I've been
uh,
bringing a bit of reassurance back into my therapy life. I really, because of the CBT I've been trained in as well, I was like, no reassurance, no reassurance. But
yeah,
actually, sometimes, we need a template of a safe holding space,
yeah,
don't we? Like, to be
yes.
like, okay, we will navigate this.
I do, yes, I do agree, especially if we're so into our threat systems, and entangled into that. And one more thing about shame. Shame is actually quite often the thing that cancer patients experience, uh, for a variety of reasons. But because everything is changing, it's not just the one thing that's changing.
Yeah.
Every single dimension of, well, again, it depends on the type of cancer, stage of cancer, type of treatment. Your social support, etc. All these different factors, but. Some patients even blame themselves. Maybe it's my lifestyle, and maybe I haven't done enough. And I know some people who really let some have extremely healthy lives, and they still got cancer because of their genes. So it's really not their fault.
Yeah.
Uh,
We are told this, aren't we? That if we do this, or eat this, don't drink.
positive thinking. Yeah, that's why we don't want to be focusing on cancer, because you might actually, well,
That's it.
trigger this
Yeah.
type, yeah, this thing that, yeah, let's not even name it. So
Yeah.
um yeah, so so
Yeah.
so that's I think a thing that's not often mentioned when it comes to cancer. So shame, a lot of shame associated with that, and also because we're suddenly so vulnerable. So,
I had
mm,
a few years ago now, just on my leg, I went to see a dermatologist and he told me it was cancer and the treatment was fine. It was a basal cell carcinoma, so it was treated very quickly. It was just a laser procedure. But I didn't tell anybody. I was so embarrassed. And I was like, how you can't discuss that? It's like it's a conversation bringer down, isn't it?
and
You would
and if you don't mind me asking, do you know why you were so embarrassed?
be ashamed of it. I think I was ashamed. Yeah.
Mm. But do you know why? What? Because that's very interesting. What?
I
Why
did.
we're so embarrassed of that?
It was an ugly mark, I suppose.
Mm.
And I just didn't want to say the cancer word. I didn't want to say,
Ah.
I just, how would you
Mm,
say that? Because I like to be bubbly and fun and I didn't want
mm,
that to be associated with.
mm.
So
Uh, yeah, yeah. So thank you for saying that, because exactly that is so. it's all about our how fragile we are as human
Yeah.
beings.
The other thing, I mean, the pull to get the treatment, to not have it part of me, was immense, and
Mm,
it was a tiny, it's
yeah.
on the
Mm,
scale of kind of cancers. It was, a very easily treatable, but I
mm,
was
mm, mm.
crazy to get it off me. Yeah.
Yeah, but there's and rightly so, so much fear associated with it, because you never know, even if it's second stage breast cancer, which is treatable. It's not well. It's wow, actually, that's a quite good diagnosis, Uh, but well, you never know. So there's this fear of, let's call it by its name, dying, So yeah, not only change and things changing, but yeah, but death. So there's that this leads to another topic, how we discuss these type of topics, our fragility, illness, death and dying. Mm,
Yeah. Yeah,
mm.
absolutely. Well, we started the conversation here, and I know you've got your podcast as well, aren't you? Your fellow podcast
I
host as
do.
well.
I don't think I'm as experienced as you are. I'm trying to get there, but I'm learning from people like yourself. So thank you for being an inspiration here, Sarah. And
It's been a long journey. Don't listen to my early episodes. I'm just fascinated. It
uh,
gets me in the room and to have these lovely conversations. So
mm.
I really enjoy kind of being able to host these podcasts.
But I really appreciate you saying about your experience as well. Thank you for that and for the courage. And I still hope it was okay for me to ask the question, but also sharing in not in a way that's seductive vulnerability, because um, sometimes, of course, people, when they want to sell something, they say something about themselves to make us closer to them. But it's not about actually sharing; it's about selling. But what I wanted to say is, when we are sharing in a way that's, I don't like uh, to use that word, but I'll say it anyway. But we're sharing in an authentic way. that's something that may be really helpful. That's about our common humanity. That's saying that even as helping professions, we are just as we're part of that life circle. And to be honest with you, uh, mm, why I am still focusing on the topic of cancer, even though that I am trying to avoid it at times. I am, um, for the reasons mentioned before, including, it's just a difficult topic, and it's hard at times. Is because it makes me really humble, and I think it's the topic that at times I don't want to be eloquent about it, because I would rather my patients say things than me saying things for them. But if I can be some kind of a voice for them, because sometimes they simply no longer have the strength. If some of the things based on my previous experiences with patients may be of help to other patients, that's maybe why this me including being here is important. So
Yeah. Yeah, and I really appreciate your time and coming on. I think it's such a valuable conversation to be having, and I can't wait to kind of pre-order your book, and I'll be sharing all the links. So we're going back into selling now. But
well, yeah, well, yeah, but yeah, well, I guess there's nothing bad in selling things that well, I hope my thing is going to be helpful, but I think it is. So there's going to be quite a few, because it's a workbook, exercises, things that you can experiment with, explore, and hopefully help you and or your patients cope with that experience. It's not about it's not the final treatment, the ultimate remedy. I would like to discover such a thing, but
no
uh,
It's every little bit, isn't there? There's lots of tools that we all need to bring so much of it.
Yeah. Yes. Yeah. Yeah. Unfortunately, I'm not a doctor who specializes in discovering these drugs that might forever cure cancer. So if there's such a person, and even if that's a nasty individual, I would think he or she would well, I would personally fund his statues, so
Yes, but I think we're never going to eliminate suffering, are we?
yes, even if we're going to live forever and be traveling to Mars, as some people are trying to do.
So thank you so much for today. I know people are going to be wanting to follow your
Yeah.
journey and your work. Where can people find you? Where are you most active? Do you have a
So
website?
find me on Facebook. I need to update my website, so that will be coming up soon. But for now, yes, Facebook is the best option to find me, and you can also message me on Facebook.
And what's
If
the
you
name
have any.
of your podcast? Because I know I'll say it
Yeah,
wrong.
so it's the name of the podcast is this one simple question, very simple question: how to live. Uh, well, obviously it's a rhetoric question because um, there's another expectation which is understandable, and it's that people have towards us as healthy professions. So how to do it, how to live best. How not to suffer. And I don't know, because it depends, so I can't be giving you the answers. I may just be helping you, exploring what's best for you, to
Right.
both be suffering less, and maybe if the suffering is if you're more at ease, then maybe also helping you thrive a little bit more. So that's my intention.
Lovely note to finish on. Thank you so much for today.
Thank you, Sarah. All the best to you and your listeners.
Thank you for listening to today's episode of Ask the Therapist. I'll be discussing all you've heard in this episode and more over in the Therapist Corner community on Substack. To join me there, just click on the link in the show notes. Until next time, take care of your mental well-being as you continue on the path to becoming the best version of yourself.